I would like to invite Ms. Arunima Shrestha. She holds a Bachelor's of Science in Public Health and a Master's in Global Health and Development from University College London. She grew up in a multicultural context and has worked for IOM in Bangkok, The Economist in London, and Crown Agents in South Sudan. She is currently based in Phnom Penh and works for ID Cambodia as the Water Sanitation and Hygiene Team's Innovation and Partnerships Manager. In her role, Ms. Arunima is responsible for knowledge management as well as driving opportunities for WASH innovation, initiatives, and projects. She focuses on identifying areas in the WASH program that could lead to solutions which enhance the end user's experience, satisfaction, usage, and accessibility of WASH products and services, specifically in rural climate vulnerable areas, through inclusive market-based approaches with cross-cutting GWSC programming components. Let me hand over to Ms. Arunima. Over to you.
Hi everyone. Thank you so much for the opportunity to speak today. I hope my screen is sharing okay and that everyone can hear me perfect. So like Dr. Vinita said, my name is Arunima. I'm currently working at IDE Cambodia, where we, as a part of the WASH team, where we use sanitation marketing and marketing-based approaches to reach rural communities throughout Cambodia. So my presentation today will just be talking about some of the research that was done in 2023 that has impacted our WASH programming now, which was led by our local team in collaboration with our IDE's Innovation Lab, as well as our team and headquarters to do some human-centered discovery and prototyping for storage and disposal of MHH products in rural areas in Cambodia where we work. So just to give a brief intro to IDE's work and how we're increasingly addressing the issue of period poverty in all of our programming, IDE builds sustainable markets to make long-term, deep, generational, and sustainable impacts in the communities that we work in. Recently, in recent years, we've been working to address menstrual health and hygiene more in our programming, as we have seen that we cannot have equitable WASH access without really addressing MHH and how it impacts women and girls in rural areas. So at the moment, we have identified the link between MHH and sanitation as being the benchmark as being female-friendly sanitation facilities. And this is the benchmark that we're using. And these are some of the requirements that we have decided on what a toilet needs to be able to be female-friendly and to ensure MHH access and periods with dignities and for menstruators in these rural areas. So we here is an image that has been adapted from Dr. Marnie Summers' work from the IRC. And this is kind of the aspirational goal that we're reaching to as one of the products that we do, that we have designed and that we have sold in rural areas is our latrine shelters of different kinds. And this is kind of the benchmark that we're working in to ensure female-friendly toilets. It's good signage, it's good lighting, access for latrine users to be able to safely dispose of their products with dignity and with safety, which is something that we often take for granted in urban areas, but through our work, which I'll explain in more detail, is not as accessible in some of these rural areas. So at IDE, as a part of our market-based approach, we really incorporate human-centered design approaches in all of our discovery and research. So here is an explanation of some of the research goals and the methods that we used in order to understand how we can develop a low-resolution prototype for menstrual health, hygiene, storage, and disposal that can be integrated into our pre-existing latrine shelters already. As a part of our market-based approach as well, how we do this is that we have a full-time team of professional sales agents, which are members from local communities who are trained in sales to go to rural households door to door to present sales presentations in order to share the benefits of investing in a WASH product with rural communities. The MHH angle of this is that we wanted to also use this research to help us to develop effective messaging that all of these sales members and sales agents can use in order to improve MHH for women and girls in rural Cambodia, so that our sales presentations were also including vital MHH information. And this research was also one of the main goals of this research was how do we effectively address MHH from a context-specific and community-driven process as well. So here is just a map of the area that we worked in Siem Reap province in Cambodia. A lot of IDE's existing customers in rural areas are customers of something that we call the interlock shelter, as well as something that we call the sky latrine. The interlock shelter is a latrine shelter that is easy to build and is built with interlocking bricks, which has reduced costs and the barrier to costs for a lot of rural families, so that they are able to build latrine shelters on their household property, which are sturdy, resilient, and are durable during floods. The sky latrine is a latrine that was developed and has also had some positive benefits to women, girls, and elderly populations, as the latrine has been built for seasonally flooded communities, where we have discovered a lot of women and girls have extra barriers and challenges to accessing MHH products, as they live in communities that for 6 months of the year might be flooded up to 4 to 5 meters up to their household, and for the rest of the year the flood recedes, and then they'll have to be climbing up and down to be able to access toilets if they do not have a latrine in their own household areas. So yes, this just shows the amount of women from these local households that we talked to. Men were also present in some of these interviews, and we also were able to talk to some female local authorities, which are, their titles are the Commune Committees for Women and Children in Cambodia, and they have the mandate for increasing wash access in their communes and in their villages. So here, I'll just run through some of the key findings of our research. The way that we wanted to set up the research as well was to develop these personas. These personas are fictional characters which are presented to show a particular collection of characteristics that who share similar attitudes and beliefs in order to kind of group our research. And through our research, we found that the two personas that we most encountered, and the ones that we wanted to pursue through our sanitation approach, was a young girl who was having her first period, and also an older woman who was using a mix of products to meet her MHH needs. We realized, we quickly found that all the personas had similar pain management, similar barriers, especially related to heat stress as well, which is a huge problem to address in rural areas of Cambodia. So here is just kind of a matrix that we used in order to help kind of solidify all of our personas. And as you can see on the top left box, which is the young girl having her first period, it shows that her level of structural freedom and open to new experience, which in this context would mean openness to trying new menstrual products, openness to hearing about pain management techniques that might go beyond traditional methods, is quite high, but that her level of knowledge and access to resources in order to have all of our menstrual health needs met might be quite low. If you look over to the middle section, you can see that our second persona, the woman using a mix of products to meet all of her MHH needs, is right in the middle, as we found that most of the women that we talked to had more access than young girls to knowledge and resources, but might not be as open to trying new methods, trying new pain management techniques or new products, as the openness might be a bit reduced due to entrenched norms and some societal attitudes towards managing periods. So here, just a quick graphic of how we mapped a young girl having her first period with all of the kind of barriers and stressors that I just described. And to the right, you can see a woman who is a bit older and is using a mix of MHH products such as sarongs, tampons in some cases, but mostly disposable pads. Some of the key learnings from this research that we found were, I'm sure not new to anyone on this call, but that there were a lot of taboos in these rural areas and a lot of hesitancy to use certain products that a lot of women and girls felt might block their periods, such as menstrual cups or tampons, and especially the sight of blood and leaking on clothes was seen as unlucky and something that a lot of women and girls should be trying to hide. The point about pain management was also quite interesting because we found that a lot of women were believing that paracetamol or Panadol could be addictive and were trying to deal with their pain naturally. Disposal, which was a huge learning for us as a sanitation marketing program, was that women living in climate vulnerable areas and seasonally flooded areas were having huge barriers to disposing of their MHH products. So for example, women living in these stilted households, we found were, during the flooding months, if they did not have a latrine in their households and there were 4 to 5 meters level of floods, they were often storing all of their used pads in one plastic bag, and they would just keep 6 months of worth of used pads hidden under their beds or hidden under cupboards in a discreet area. And then when the flood recedes, then they would feel it would be safe enough to dispose of their menstrual products. So after all of these learnings, which I know I've gone through fairly quickly, so please feel free to ask any questions related to this work and I'd be happy to address them. So what did we do after all of these learnings and this research? So the first thing was that we were able to develop some tailored messaging in all of our sales presentations. Like I mentioned earlier, a key method of our approach is using sales teams and professional sales agents to disseminate these messages and in order to convince rural households to invest in wash products. Oftentimes these sales agents will be the first point of contact for a lot of these communities to wash and to speaking about wash and asking someone that might have more information about the benefits of wash. And so as they are also seen as both sales agent and an educational resource, we decided that integrating these key GWSC and MHH messages into these sales presentations would be extremely useful. And as you can see here on the pamphlet, this whole slide is dedicated to MHH, and we have gotten good feedback from this because our sales team have said that this has encouraged them to. They've observed that it's encouraged some households to talk more with their families about periods and about these things that might be seen as taboo. The next step as well is that ID's approach is also to build the local capacity of female local authorities, such as the CCWCs that I previously mentioned. From our training curriculum that we have addressed to do training of trainers modules, we have developed a new MHH module as well, so that female local authorities are the ones who are disseminating information about menstrual health and can also act as the local trusted point of contact to rural communities as well in their areas. The last and, in my opinion, most interesting highlight and finding that we found is that after all of this research, we decided to integrate menstrual health bins and as well as a drying hook and an MHM sticker, which visually informs women and girls what to do after they are wrapping up their pads and how to dispose of it safely. What we found is that something, again, that might seem very simple as throwing away pads into a bin discreetly, we found that a lot of users before this were not doing that, and that they were burying their pads every single time in their household, or they were burning them because they felt ashamed of using MH products in the same latrine structure that a lot of men and boys in their household or the neighbors might be using as well. So in making sure that all of our latrine structures and latrine shelters had these MH bins and had these MH stickers, we found that some women actually found it as a really helpful tool for having these discussions about first periods with young girls in their families. And this specific picture is highlighting a woman that we spoke to, saying how the easy to follow MH sticker and the visuals served as a really helpful tool for her to open conversations with her daughters and her nieces and about their periods and how they should manage them. To end my presentation, I just wanted to highlight that IDE wants to really address that challenges faced by women and girls in rural areas are extremely multifaceted, and that we believe integrated programming and partnerships are extremely essential to reducing stress around and improving the health of rural women and rural menstruators in Cambodia, and that for future programming, we would really encourage more education, access to a variety of menstrual health products, and importantly, access to solid waste management in rural areas that go beyond disposal as well, because we have seen that in rural areas, it's also the solid waste management piece that needs to be incorporated to ensure dignity to MH access. We wanted to thank our donors for this, and thank you so much for your time.